All right, so you are working your private practice, you're seeing clients, and things are going well, right? That's fantastic. I want to take a moment to take a pause and look at quality of care versus the quantity that you've been working on so far. And I want to take a moment to really look at that from a medical records, clinical documentation perspective. Now, if you are brand new to this field in general and have never written a note, here's a little bit of a one-on-one. So as a private practice practitioner, you are essentially kind of medical staff, but just from like that mental health perspective. So you will be keeping a medical record of the work that you do with your clients. That's going to include some type of intake assessment, right, where you are screening them, looking at what their needs are, and assessing how either you're going to help or how you're going to connect them to the needed help. Every session that you do with them, you're going to be writing some type of note to document what interventions were completed during that time and how it links to your goals. You will have an overarching treatment plan that outlines specifically what the client's goals are and how you and the client are going to work together on those goals. And every 90 days or so, you're going to be reviewing that treatment plan, seeing what's working, seeing what's not working, celebrating the wins, but also looking at the barriers and any changes that needs to be made to that treatment to help them progress further in their goals and their wellness. Once treatment is completed, you're going to be writing a discharge note. So something that wraps up the work that you've done with them, and hopefully it's a successful discharge and you're saying that they're happy, they're healthy, they're on their way. But you're even writing a discharge note if things don't go as intended and you need to refer out to a higher level of care. And then there's a bunch of other supplemental notes in there, like a chart note. There's a what is a psychotherapy note, which is not in the medical record, but something that you might want to keep yourself. If you're sending letters to clients, how to do that properly and kind of quickly, so you're not spending all your time writing letters when you already have enough on your plate with treating and documenting. If this is something that you're struggling with, it really can be a confidence killer as you're growing your practice. And also, I mean, you really want this to shine well because other professionals could potentially be reading it as well as the client, and you want your documentation to reflect the good work that you're doing. So if this is something that you're struggling with, I do offer a course that is tailored specifically to what is in clinical documentation. How do you kind of display medical necessity? I highly recommend you checking that out. I will link to it below. This way, if you need either a tune-up or you need a Crash 101 course, it is there for you. Because it is an important skill that is needed for private practice that isn't always spoken about in grad school. You might have already had some experience with it if you're coming from an agency work, but now that you're on your own, you do want to make sure that your documentation is tip-top shape. So again, if you need help with it, there's a link down below. Hopefully you have a system that's working for you, and if so, fantastic. Keep doing it, right? Don't break what's not broken. But I just wanted to throw out what is available to you if you did need a little extra help in that area. All right.